One of the earliest questions we get is, what kind of experience do you have and what kind of experience should I look for in my facelift surgeon? Well, the surgeon should be board certified. That's one of the key indicators of someone who's trained and has some special expertise in this area. The other aspect is how much of this type of surgery do we do? As patients, you want a surgeon who has regular experience with this kind of surgery, and that should be on a weekly basis. You also want to look at a patient's before and after photos. That's one of the key aspects of the care they deliver and the kind of outcomes they get. A picture says 1,000 words, and there's nothing better than looking at those pictures to give you an idea if that surgeon is going to be the right surgeon for you. Finally, you just want to have a conversation with the surgeon. There's a lot of options, but you want to make sure you can develop a good rapport with your surgeon, because that trust and that relationship is going to be one of the building blocks to the care you get and the outcome you get. Another important question to ask your surgeon is their policy on revision surgery. Sometimes surgery doesn't always go as planned and patients need revision work. At the Facial Plastic and Reconstructive Surgery at Mount Sinai, we see a fair number of this type of surgery. And it's very important that you review with your surgeon ahead of time what their policy on revision surgery is and what their rate of revision surgery is. People often combine cosmetic procedures. And if you're going to go for surgery and the recovery period afterward once, it makes sense to do it all at once instead of spread that out over many years or many months or years. Doing your eyes and your neck at the same time is a fantastic idea if that's what you're a candidate for and if that's what you're interested in. One of the things I always counsel patients, and I think it's the most important advice I give them, is do what you're interested in. Don't do something because it's a whim or because I convinced you. That's never the right thing to do. The final question you want to ask, once your surgery is done, what kind of recovery can you expect and what kind of follow-up can you expect? I tell all patients that they should expect a 2-week recovery period with a return to all social activities after 2 weeks. For the first week especially, they'll be swollen and sometimes a little bruised. Their sutures will come out over that first 1 to 2 weeks, and then by 2 weeks they'll be ready to return to work. Follow-up is a very important part of what we do, and we make sure we're available to patients 24 hours a day. We have a strict follow-up schedule with multiple visits in the first 2 weeks after surgery that then get spaced out after. For more information, please see our website at mountsinai.org/facialplastics.